Thank you for joining me today. Could you please introduce yourself to everyone?
My name is Alex Reinhardt. I'm an athlete trainer at Wilmington College. I'm an assistant professor of sports sciences. I'm a graduate of Wilmington College, a doctoral student at the University of Idaho working on my DAT.
Great, thank you. What does evidence-based practice mean to you?
So to me, evidence-based practice is really patient-centered care. The way I look at it is you have patient-centered care, which is made up of evidence-based practice and then practice-based evidence. So we have to have evidence in the literature showing that something is successful in whether it be a treatment or a diagnostic technique. We need to have some support to it. And that's where we get our evidence-based practice. But on the flip side of it, I also think that we have to have practice-based evidence. And in terms of that, we have to understand how we practice as a clinician. How good are we at using, say, a mulligan concept to treat a patient? So once we understand, what the literature says and how good we are at something, that's when we can really integrate those two to create a medical environment that is patient-centered, because we are going to be providing the best possible care to the patient. And to go along with the patient-based evidence, I think we have to be creating evidence in our own clinical practice, because there are so many things we have yet to explore as a profession in terms of treatment or diagnosis or whatever it is, that people are doing clinically, but we haven't done any evidence for. So I think we have to create that evidence ourselves and get that out there so people see it more reported in the literature.
So how are you creating that evidence in your daily practice?
So I keep patient-rated outcomes on almost all of my patients. And every semester I go into the semester with an a priori approach. So what that means to me is, I want to say, hey, how good am I at treating ankle injuries? And this semester I'm going to assess that. So each ankle patient that comes in, I'm going to give them a DPA scale, an NRS scale, and some other patient-rated outcomes, and we're going to track how efficient I am at treating those. So each semester I kind of pick a few things, whether it be ankle sprains or hamstring strains, and I create that evidence and look to see how good I am at that. Because if I'm as good or equal to the literature, awesome. I'm doing a good job. But if I'm not as good as what's reported in the literature, I need to go back and figure out how to make myself better. Additionally, when I create good evidence, case series, or a well-designed clinical research study, sharing that stuff back in the literature. Just recently I presented on some case studies using the mulligan concept, and in the process of developing a few more articles for publication. So I think that's a big part of us as athlete trainers, is creating our own evidence, sharing that evidence, letting others critique that evidence, and then in the long run, better that evidence.
Where are you finding your knowledge base for evidence-based practice?
I mean, it's a huge question. I think it comes from a lot of places. Learning from older athletic trainers. A lot of older athletic trainers think that, evidence-based practice is here to say that I don't know what I'm doing. Well, you do. I'm just here to quantify what you're doing and see if it's good. So, I learn from older athletic trainers and what they're doing and apply to my practice. I investigate it, see if it works. Going into journals, obviously looking at the more clinically oriented journals. Probably the ones I read the most often are the International Journal of Athletic Therapy and Training, or the IJATT, and Athletic Health and Sports Sciences. Those are where I go to most often to gather some of the evidence. But again, I'm a big proponent of creating your own evidence. I go to a lot of workshops, whether it be on, say, the mulligan technique or positional release or myokinesthetics, and I learn what they're doing in those clinics, and I bring them back and I say, let's create some of my own evidence here. So that's a really big question. I think this evidence comes from a lot of places if you evaluate what you're hearing and what you're finding well.
For young professionals, what do you believe is the first step to implementing evidence-based practice?
I think the first step is realizing you're not going to change the profession by yourself on day one. Um, I think a lot of people look at evidence-based practice and say, I'm going to collect all this evidence, or I'm going to implement this into my practice, and I'm going to change all these things. And if you try to change all these things at once, you're going to crash and burn. When I really started changing my clinical practice, I tried to do that. I tried to change everything I was doing, and it didn't work so well. But learning to say, hey, I'm going to take this piece by piece. I'm going to be very systematic about it. I'm going to be very planned about it. And each day try to improve what I'm doing. That's the key, is to start small, start systematically, and continue that path.
For my last question, why do you think evidence-based practice is important for the growth of athletic training as a profession?
I think it's key to our growth. And I know I've told this to you a few times before. The way I see our profession is we really do three things. We do diagnosis and rehabilitation, or diagnosis and treatment. We do emergency care, and we do injury prevention. So there's three things that I really see our profession doing. When we look at athletic trainers, when we look at diagnosis and treatment, first of all, I'd say a very large majority of us have no idea what we're doing in terms of diagnostics, in terms of treatment. And by that, I mean, we don't know how we're diagnosing. We don't know what we're looking for. And when it comes to treatment, we are doing the same old things we've been doing for years. We do ice and progressive resistive exercises. Well, rarely am I finding in my data now, that's not what we need. We've gone beyond ice and 3 sets of 10. There's things that we can do that are better. So when we look at that first thing our profession does, we don't do it well. And then we look at emergency care. I think some of the research coming out shows that we're not really well prepared as a profession to do emergency care. So we lose that part of what we do. And then we look at injury prevention. How many athlete trainers have no idea about implementing injury prevention programs? And in reality, that's probably one of the most important parts of our job, is preventing that injury, making that patient, that athlete better before they get hurt. So those are the three things I really see us doing. And when we start looking at those, we don't do any of those three things very well. So to move our profession forward, we have to start doing those things well, and then collecting data that says we do those things well. So when we start collecting that data, not only do we make ourselves better, then we can share that with other professionals in AT and make them better. But then what happens is, as we start to develop evidence and we move forward as a profession, we now become more respected intermediate level providers instead of this technician that we're kind of seen as today in the medical field. When we have that evidence, then we can make a better case for reimbursement. Then we can make a better case for us being a respected medical profession. Because right now, we don't really sit in a very good place. So as we create our own evidence and we integrate good evidence into our clinical practice, we get better. We improve as a profession. And I think right now we're really at a crossroads as a profession moving forward, that if we don't embrace this idea of evidence-based practice and critiquing our own practice and bettering our own practice, we die as a profession because we don't do our three main jobs very well. And if you don't do your job well, you get fired. So, if we don't integrate that evidence and get better, we're gone as a profession. But we also, at the same time, sit at this area, this crossroads, where if we embrace those things, we embrace evidence, and we show that we're really good at what we do, and we become the go-to primary care medical provider for athletics or for active populations, the sky's the limit for the profession. So, to me, evidence-based practice is the crux of where we are as a profession. If we don't embrace, we lose out. If we do, we have an opportunity for a very bright future. But what I do know, all those things are kind of speculation, But what I do know is if we sit at where we are and we don't embrace evidence-based practice and we don't embrace change, we're not going to get better. If we look at where we were 10 years ago as a profession in terms of salary, in terms of productivity, and then where we are now, it's pretty flat, while our peer professions have moved forward. So we have to do something. We have to embrace, in my opinion, evidence-based practice, creating our evidence, knowing what we do. I emphasize that we as an athletic trainer have to know. We can't just say, well, yeah, I'm good at what I do. We have to know that we're good at what we do. And that's all centered around evidence-based practice, practice-based evidence. And in the end, that's patient-centered care. At the end of the day, our number one goal as a medical provider is quality patient care, making the patient better.
Great. Thank you so much for your thoughts. Is there anything else that you'd like to add that you didn't have a chance to address?
I think I was able to get on my soapbox well enough in those questions. I know I've talked about these things with you before. But yeah, I think, what we're doing in terms of bettering our education, in terms of things like the DAT and clinical practice doctorates, this is the way forward. And I think it's going to be us, this group